Hello and welcome to this press conference concerning the vaccination campaign against COVID-19 in Quebec. My name is Marjorie Boileau. And so for this opportunity, the Minister for Health is together with the Minister of Education, Mr. Jean-François Roberge, the Minister of Higher Education, Ms. Danielle McCann, and as well as the Director of the COVID-19 vaccination campaign, Mr. Daniel Paris. Without further ado. Thank you, Marjorie. So hello, everyone. I am here to talk to you about the vaccination of the 12 to 17-year-olds. And I really appreciate the presence of both my colleagues here, Jean-François Roberge and Danielle McCann, as well as our Director for Vaccination, Mr. Paris. So the vaccination of the group of age 12 to 17 is good news. It will allow us to vaccinate even more Quebecers to get to our 75% vaccination coverage. I would like to say, first of all, that we got the green light from the CIQ, the Quebec Immunization Committee, indicating that the minimum age to administer the vaccine for Pfizer could be lowered to 12 years of age. This notice is supported by new data that are very promising for this specific age group. During clinical trials, after 2 doses of the vaccine, it's important the vaccination efficiency in that age group is close to 100%, which is better than for adults. So in the vaccination modalities, we are counting 530 young people from 12 to 17 years of age, representing 6% of the total Quebec population. So it's a huge pool, and it's important for us. Now, how are we going to proceed to vaccinate this group? I'm going to let my colleague give details for education and higher learning, but I would like to give you just a general overview with some important dates to keep in mind. First, it will take place from the 25th of May to the 23rd of June, and there are 3 dates to keep in mind. First, the 21st of May, which is next week. So, in fact, tomorrow, because we're already on the 20th of May, 2 vaccination sites, drive-in sites, for family, the one that we announced yesterday at the Circuit Gilles Villeneuve and the Trudeau Montreal Airport. The second date, the 25th of May, which is next Tuesday, people will be able to make appointments in mass vaccination centers. You know which they are now, or by now, with schedules that are reserved in the evening and on weekends to accommodate as many people as possible. And the third date, as of the weekend, the 7th and the 14th of June, vaccination in school settings, and I will let Danielle and Jean-François give clarifications on how that will take place. As far as the second dose for that specific group is concerned, I want to make a reminder that the second dose for that age group is going to mainly be given before the back to school period. That is what is going to allow us to start the school year, the 2020, the 21-22 school year, the right way for both parents and children. I would like to make a last call out on the vaccination. Just as for all age groups, we must reach a vaccination coverage of 75%. I'm convinced that parents, and most particularly children, will be there to get vaccinated. But I'd also like to encourage the age group of 18 to 44. The people in that category, there are people who haven't been able to make appointments yet. I would say that if we want to have a nice summer, we need everyone's collaboration. You will see in the charts that we're publishing, in those age groups of 18 to 44 years of age, there are 360,000 appointments for vaccination that have not yet been taken to be able to get to the 75%. So we have all the schedules so that people be able to take the time to make an appointment. And I would say, to everybody else, hurry up, because the 12 to 17 are starting to get vaccinated next Tuesday. So if you don't make an appointment in the next few days, well, it's that age group that is going to be taking up all the schedules that are available. So, the 18 to 44, there's 360,000 of you that we want to, reach in the next few days. Go get your appointment now. To conclude, we this week presented the end of lockdown plan, as well as the lightening and all of the measures, the removing of the measures. All of them are conditional to the epidemiological situation, but also on the vaccination coverage. The Premier and Dr. Ruda have been very clear on that. So I encourage you all to go get vaccinated, make your appointment. I'm convinced that all together we'll be able to win the COVID fight all together. Thank you so much. And the mic now to Jean-François. Thank you, Christian. Very happy to be here with my colleague Christian. Same thing, very happy to be here with Daniel, my colleague from higher learning, higher education, as well as Mr. Daniel Paré, who is helping us, everyone, all Quebecers, to be able to get through this trial in the best way possible. Really superb vaccination campaign. Other states are envying it. Let us be proud of what we're doing in Quebec and all of our champions here. I'm very happy to be with them today. Today's an important step, a step that will get through for the vaccination of our teenagers, thanks to the school board, to the school network, but also all three ministries: health, education, and higher learning. But also on the field, we've been talking about it, and it's been a certain while already that the Ministry of Education and the Ministry of Health have been talking with the CIS, with the CIUS, with the general directors, with the school boards, both the English and the French boards, as well as the directors of the private education sector, to prepare the coordination work, to make sure that this vaccination operation in a school setting or outside of the school setting, but the vaccination of teenagers has to be a success because it is the solution. It has to go through a lot of collaboration, which has already been started. It's true that this year we have succeeded in keeping our schools open almost all the time. Sometimes it was more difficult in emergency zones, but we did manage to get through this pandemic year by keeping very often our schools, our classrooms open. As I speak to you, 98% of classrooms are open. I think that we can all be very proud of that and thank the people in the field who are making incredible efforts to make sure that the students are healthy and safe. So 80% of classes open during the pandemic is an exploit, but it is made through a lot of efforts and constraints, health and others. For example, the secondary 3, 4, and 5 students that are going to school one day out of 2 and homeschooling the other day. So we're getting there, but it would go so much better, and it will go so much better when the vaccination operation is over. It'll be so much easier to go towards normality in the health network, and we're probably able to free ourselves from many of the health constraints that we are experiencing right now that allow us to keep our schools open, but we wish to anticipate more normality in the school network when we go back to school, and that is why we need to succeed our operation with the vaccination. My colleague talked about it. There are some important dates. As of tomorrow, Friday, the 21st of May, vaccination drive-ins. As a family, you can make an appointment. And then the 25th of May, the 12 to 17-year-olds can make their appointments. And I would like to also specify that we're going with a hybrid formula here, since the 12 to 17 age group will be able to get vaccinated as a family in the evenings over the weekend, but they can also get vaccinated thanks to the collaboration of the school. So you send your child to school, and sometimes right at school, but most, the times they take the bus, they go to a vaccination center, and then they come home and they'll have been vaccinated. To succeed with all of that, we need the collaboration and we need coordination, we need facilitation, and that is the work of the school network. To transmit the information that comes from the health network, inform parents, collaborate with the parents, make sure that we have the consent forms that are necessary for young people who are less than 14. So 12 and 13-year-olds, of course, need to have a consent form that is signed by the parents or the legal guardian. For 14 and over, the teenagers themselves have to fill the form and have to consent. The network as well is, of course, going to coordinate the transportation of students towards the vaccination sites and lend out sites sometimes, because it is possible that, for example, in more isolated places or perhaps in certain schools where there really are students who have particular difficulties, it could also be done in those cases right at the school. if some young people unfortunately cannot be vaccinated in June because they have health problems or a serious problem, they can do it over the summer. But we really are trying to target vaccination at the beginning of June, so that is as quickly as possible. And I'm confident that we'll get there because everybody wants, of course, for our schools to be open, but also wishes for our schools to go back as much as possible to something more normal in the fall. And that is something that we can only succeed if we succeed with the vaccination campaign. Thank you so much. Hello, everyone. I also wish to salute my colleagues, Christian and Jean-François, as well as Daniel Paris. So I am very happy to be here with you today. We can see that this truly is a very large-scale operation that is starting in a very short amount of time. As the Minister for Higher Education, I'm very happy that young people, 16 and 17-year-olds, so the collegial level in CEGEPs, but who also go to professional training centers, adult education, all young people, 16 and 17, that they also be able to have access to vaccination to protect themselves and protect people around them. This willingness of offering them more schedules in the evenings over the weekend as of the 25th of May to the 23rd of June, added to the other measures that were announced by my colleagues, that will contribute, I am certain of it, to the success of the vaccination campaign for this age category. We're all conscious of the fact that the necessary health guidelines that have been set up since the beginning of the pandemic to control transmission, they had a lot of impacts on people's daily lives and on youth's daily lives. Thanks to vaccination, we can now hope to soon have the beginning of going back to a normal life that will bring a lot of benefit to many people, including the members of the student community. So if 75% of the public between 12 and over, including students, is vaccinated with 2 doses, as our Premier announced this week, all students in CEGEPs and universities will be able to go back to school in person during the back-to-school period at the end of August. But in order for that to happen, we all have to keep going together in the right direction and to continue responding positively and massively to this vaccination campaign. I'd also like to take this opportunity to invite all members of the student community of our colleges and CEGEPs and universities, if it's not already done, to go get vaccinated. In young adults, we can see that the response is excellent and has been excellent up until now, which is very encouraging for everything else. And we have to continue. I'd also like to take this opportunity to thank the higher education network that contributes significantly to the vaccination efforts, the staff, the students, colleges, universities, and CEGEPs that have accepted to help out in this vaccination operation. Over 3,500 people have volunteered to help, as well as campus. Many have collaborated. Many welcome mass vaccination sites. For example, Laval University in Quebec City, Montreal University, the Saint-Félicien CEGEP, as well as others. I also wish to thank all establishments that have helped out for the health network and social services, for the care and services to patients throughout the pandemic. It's been now over a year. It is with great pride that I can see the mobilization of our network. So it is all together that we'll manage to get out of this pandemic and find life back on our campuses. Thank you. Thank you. We will now start with the question period.
Donc, j'invite les médias qui sont présents dans la salle à se diriger vers les micros. Nous allons faire une question et une sous-question par média. S'il vous plaît, bien préciser votre nom et votre média. Alors, sans plus tarder.
Oui, bonjour, Henri Ouellette de la presse. Question pour vous, Monsieur Dubé.
A question for you, Mr. Dubé. As far as vaccination in a school setting as of the 7th of June is concerned, can we have more details? Who's going to be responsible for the logistical aspect of all that? Generally speaking, how is that campaign going to be organized? Well, we have our great chief, Daniel Paris, and I'm going to let him answer. Yes, well, the campaign that is going to take place in a school setting the weeks of the 7th and 14th is going to be done in hybrid mode. So right now, as we speak, The service centers, the school boards, as well as the CIS and the CIUS are working together to determine what the best model would be for them. I think earlier on, Mr. Dubé or Mr. Roberge mentioned that it will require either there will be, teams that will go to the schools, or there will be a system of buses and shuttles that will go from schools to vaccination centers. So it really will be done in a hybrid mode according to the local characteristic and according to what the two networks will have agreed on for the well-being of our youth. You were saying that the objective remains to give the majority of second doses this summer or by back to school. How is that going to take place? Young people won't be in their environments anymore. Will there be new measures? How are we thinking of giving out all those second doses? Well, Danielle, Mr. Paris can complete, but let's start by focusing on the first dose. The first dose for me is the one that, as we said, I would like that by the third week of June, a lot of pressure on Danielle for that to be completed in our two networks, education networks, for all people 12 to 17 years of age. I would just like to remind you that an average of the 15th of June, because some people are going to be vaccinated at the beginning of June and some others more at the end. But if we take the average, the median of this 15th of June to have vaccinated 500 some people that we're thinking about, that means that if we go back to the month of August, it's 60 days later, the 15th of August. So we have ample time with the right strategy and the right vaccine. So I want us to finish the first dose, and then we'll get back to you a few weeks later and say, well, listen, now we're finished with our RPAs, we've finished with everything else that we call, the first dose, and now we're going to say, well, on average, people are going to get vaccinated in such and such a date. I think that, and Danielle could comment on that, but we could indicate at about what date the second appointment will take place. But what is important for us is to really finish with the first dose by the end of June. So, virtual questions now. You talked to us a lot about going back to normal concerning the next back-to-school period. I would like to know whether the objective of vaccinating 75% of the 12 to 17-year-old age group, and I mean with 2 doses here, if we've reached it, might we think that the back-to-school period will be done without masks? Danielle, did you want to answer when you were talking about normal? Did you want me to answer this? And I'm talking here primary and secondary school. Okay, well, at the beginning, initially, and I can ask my 2 colleagues, of course, for us, and that is why we've said it clearly at the press conference with the Premier, we truly need to have both doses to remove the mask. That is the greater principle that I want people to remember. That is why we've been very clear with the vaccination of the month of June, as well as saying that it will be over at the end of August. We don't have exact dates, but I would say that we absolutely need that. When Ms. McCann was talking earlier on about going back to normalcy, for us, the condition is to have 2 doses handed or given before back to school. Danielle, did you want to add anything? The comment that I would add to that is that the second dose by the end of August will change everything completely. For me, that was the great news for Tuesday at the press conference of the Premier. So, of course, we're going to examine that with public health, and I think that we have to give ourselves a little bit of time. But, of course, we are going to be completely elsewhere at the end of August, and there will be clarifications. For example, as far as higher learning is concerned, right now we are having discussions with public health because the announcement was made on Tuesday, and we must truly have a little more discussions with public health to give clear indications to our establishments. As far as the question of the mask is concerned, I think that we can wait a little bit. We have to see with public health to give that information. As far as the primary, preschool, and professional centers, high schools, all of that, I would say that the work that we're doing with public health is continuing right now. And of course, our schools are open right now. They will be open in the fall. That's not the issue. But what will make the health measures that we'll have to keep our schools open? Well, that is being talked about right now with public health. We don't have more details. Of course, the first vaccination that is coming up for the 12 to 17 age group, and the assurance that we have that a majority of young people will have had their second dose before the back-to-school period, well, obviously, it plays in favor of having fewer health measures in the fall. But we'll give more details, all the details for back to school by the end of the present school year. Now, I know that you didn't want to say too much about the date of the second dose this summer. I would have liked to have known, however, for parents who are going to be leaving on vacation with their children who might not have the flexibility of saying, any time in the summer. Will there be some flexibility as far as the date for the second dose of the children? I think that we understand very well what the situation is, and I can tell you, Danielle, to explain a little bit where we'll be at by mid-August, and might give us an idea of how we'll be working. Once again, what we are preparing right now is really solutions. And during the press conference, Mr. Legault and Mr. Dubé, you really committed yourself, saying that people would be vaccinated before the beginning of the back-to-school period. And we know that before that week, there's more of an administrative week, so we have a window there that could be well used for the second dose, amongst other things. And at the same time, of course, if the doses are there, as the federal government is predicting it to us and announcing it to us, we'll have many opportunities to vaccinate our young people, possibly with their families. We have really great examples this week. We've had vaccination activities, family drive-ins, and the nice activity at the Grand Prix. But there will be others like that in the summer. There will be a lot of really great opportunities of making sure that our young people get their second dose, to give ourselves a lot of opportunities to be able to, for the health guidelines and all that for the back to school. Thank you.
Oui, bonjour. Je voudrais...
Yes, I would like to understand what will happen for students who end up, I understand that, 12 to 17 is mainly vaccination in a high school setting. But what happens for a student who's 11, who's in grade 6, who won't have a first dose in the month of June, but who, at back to school, when they get to secondary 1, then they'll be 12 and will be at second doses? What will happen with those kinds of students? Also, secondary 5 students who will get their first dose in June, they will get to CEGEP in September, and they might not yet be 18. So what I understand is that you invite them, if they cannot have one or the other of the doses in school, they then have to register on Clic Santé to get their other dose. Is that what it is? That's an interesting question, because we're talking here about exceptional cases, and they're important. When you're a parent or when we are in that age category, what's going to happen with those children? Well, first, one element. There are students who are 12 right now who are in grade 6, and they can go get vaccinated with their family as of the dates that we mentioned earlier on, the 21st of May for drive-ins, 25th of May for family bubbles, and the week of the 7th and 14th of June in school networks. The schools will be transporting grade 6 schools, children, to the vaccination center. We'll offer that service to the families to help them. So that is the exception. People who are 12 but who are still in primary school, I didn't want to talk about it. But after the first dose, from what I understand, the second dose will be offered in the month of August, regardless whether you're 12, 13, or even 17. I think Monsieur Paris is going to complete, but I don't see an issue with that. I would like to complete what Mr. Robert just said. We have the means now. We have a vaccination registry in Quebec. We have a good system to make appointments, to give people the opportunity to take care of exceptional cases. And thank you once again for allowing me to say that, yes, in fact, the approval of the Pfizer vaccine for 12-year-olds is allowing us for the summer, and also for people who haven't chosen to get vaccinated, all age groups together, they will still be able to have the opportunity of getting a first dose of the vaccine. And as well for the second vaccines, well, we'll have the names. Everything will be in a registry. We'll be able to make sure that the vaccination coverage is going to be done properly with the second dose. So don't worry about that aspect. We have the means of covering the exceptions. My second question is concerning the consent of parents for children 12 and 13 years of age. Is the consent required from both parents, or is one parent's consent enough? Well, as far as the consent is concerned, it's one parent. One parent's consent that is necessary for the vaccination. However, once again, we are going to be making sure that families receive all the necessary information to be able to take an informed decision. And vaccination in a school setting for the age groups that requires a consent it's not that many, So we're used to managing exceptional cases where there might be issues as far as the consents are concerned between the parents. But once again, that aspect is something that we're going to be continue business as usual, as we're used to doing with our families. Thank you. For people 16 and over who are not in high school, so they absolutely have to make an appointment on Clic Santé to be able to get vaccinated? Aren't you scared that there might be problems reaching them? And we'd like to know, is there going to be prom for secondary 5 students? Well, for the students 16 and over, of course, or people 16 and over, of course, they'll be able to get vaccinated as of the 25th of May in vaccination sites. So there are some that are in CEGEPs, there are some that are in the community, there are others that already are working. Some are in professional training. So all of those young people, we're calling out to them today. We need them for them to go get vaccinated so they can go on Clic Santé as of the 25th of May, so as of next Tuesday. And there are schedules that will be added in the evenings and weekends to facilitate access. We know that it can be more difficult during the daytime for them. So to ease access, they will be able to go more even over the weekend and evenings. So the offering is there, the vaccines are there, go get them. And to complete with prom, this is a question that has been asked many times, and I so fully understand. And sometimes some people have, a small ceremony in grade 6 as well, just to, have a ceremony from going to primary school to secondary school. But it's even more important for our high school students at the end of secondary 5 who are proud and who want to be able to do something special for it. The modalities are still being worked out, and we're going to be announcing it later. I know that people are looking forward to having the answer to know what can be done, what can't be done, but just simply to tell you that we'll be able to give you that information in the coming days. So I understand that there might be a possibility of having a prom? Well, listen, we're having discussions with public health, and we'll give you the information in the coming days. As far as the administration of the second dose is concerned, for those who have had COVID already, what are the steps to be followed? People who have had COVID, should they get 1 dose or 2 doses of the vaccine? Because there are experts in certain jurisdictions of the world where people are still told that they should get 2 doses of the vaccine even if they've had COVID. On that, I'm going to be very clear because this week there might have been different opinions that were emitted. We follow the opinion of our public health experts, of the Quebec Immunization Committee, who has been very clear, and I'll repeat it. Those who have had COVID, unfortunately, over 300,000 people, those people only need 1 dose. Very, very clear. I have asked Dr. Ruda again because, unfortunately, opinions of other experts that were that were mentioned this week, and it creates confusion. But let's be very clear: people who have had COVID here, it's only one dose. That is how we're doing it for them.
Bonjour à vous quatre. J'aimerais entendre.
I would like to hear Mr. Paré on a way of reassuring parents, perhaps a little bit. So what kind of vaccine? What symptoms can be observed during the Pfizer study, for example? What can we expect for our young people if people are hesitating to having their young people vaccinated? Well, listen, the vaccine that has been approved by Health Canada is Pfizer. All the studies have been made with that particular vaccine. It is safe. And as Mr. Dubé was mentioning it, our Quebec Immunization Committee and our Public Health Institute have approved it. And in terms of side effects, they're exactly the same as they are for us, adults. Sometimes a little bit of pain at the injection site, as well as a little bit of being tired and maybe even a little bit of fever. But once again, it's like any other vaccine, no more serious than what we're used to. And I would just like to add, Danielle, and you're quite right to say that, but I'd like to repeat it. That is why we had waited for the official notice of the Quebec Immunization Committee, the CIQ. Up until now, together with public health, we've seen it. People look at the vaccination strategy that was recommended to us by our experts, and it's excellent. So once again, we're waiting for that particular expert opinion before starting. So I think that parents should feel reassured. We are following the CIQ, we're following our public health, and now we're ready to start this machine because we did have that opinion of our experts. So that should reassure parents of being able to follow, once again, the opinion of our experts. So right now, we don't know, there isn't a percentage of a number of young people who are going to get vaccinated in school or in a vaccination center. We don't have an idea of the portrait in Quebec right now. Well, listen, I'm not talking for the CEGEPs and universities because it's more difficult because those people are more mobile and they'll have they're going to have access to our greater vaccination centers. So I would say that most CEGEPs and universities are going to be done through vaccination centers. As far as the primary and secondary networks are concerned, I would say a little bit what Jean-François said, but I'll repeat it to parents. If I had a general rule to give that I've discussed with Daniel, I think that about 20% of our young people in primary and secondary school are going to get vaccinated by what I would call mobile clinics. That is to say, where you go, we'll be going to the schools. And the other 80%, it really is that we'll be taking school buses and we'll go get those young people and we'll be bringing them to the mass vaccination centers. So we have to let school boards take the necessary arrangements. But what we wanted to announce to you was the greater principle and to let the school boards and look at the details. But I think that the 80-20 is probably the best representation that we could think of today.
Oui, bonjour. Vous m'entendez bien?
Just a clarification. Have I understood properly that as of 25th of May, anybody 12 and over can register to go get vaccinated, not necessarily in school? Is that correct? Yes. What I'm wondering is, by August, end of August, for the second dose for young people, are appointments in vaccination clinics planned? Or, for example, are we thinking of reproducing efforts from schools for those who haven't been able to go because they were on vacation or anything like that? What would be the plan, the logistical plan, concretely in the field for the second dose? Well, I'll let Daniel repeat what he said earlier on, but go ahead. When we look at the offering that we're talking about today, it's very broad. We want to make the vaccine accessible, either through our vaccination sites and in partnership with school vaccination. So for us, the idea is to offer as many possibilities as possible. There won't be any excuses to say, well, I wasn't available on that week. We have to make sure that there's going to be offering. But, just in case, we want to give ourselves even more possibilities, and we want to give ourselves a safety net of offering the second dose for those who might not have had the opportunity of having received it during the summer. But one way or another, once again, I want it to be clear, we have the means of vaccinating people. We have the information. We're going to have really great partnerships. And if the vaccinations are there, if the vaccines are there, and we have every indication that they will be, our school, the students will be vaccinated before going to school. Are you thinking of having any kind of restrictions for children who may not be vaccinated in primary or high school or CEGEPs, universities, as far as the access to classes in person? Health guidelines, for example, would they have to wear masks? Is there anything that is planned for those who won't be vaccinated? There's been no discussion on that right now, because I would say that the principle is to get the highest vaccination rate possible. Right now, I think that public health has been very clear. At least 75% of vaccination of the age group from 12 to 17, that is what is our objective with 2 doses. So, of course, at some point, we'll reach immunization rates that are very significant. But what I would say for the time being, let's be very, very clear. We've had an excellent response from categories of 18 years and over, and I think it will be the same thing. And that is why, we're still talking about 500,000 people, and I'd like to remind you, we can vaccinate 500,000 people right now per week. So I just want to make a reminder that for us, it's not the amount of people that is difficult. So the answer that I'm giving you today, if people are there, things are going to go very quickly. And once we will have finished with this first dose, we'll see where we're at, and we'll be able to plan the second dose very well. We're ready to do it. We have the vaccines, and I'm sure that Quebecers are going to be supporting us in that. And Christian, the importance of getting to that 75%, I'll give you an example. The isolation that our students experience in CEGEP and in university, that is the key aspect. Vaccination, getting to 75%, to be able to have life on campus, not only the classes, of course, but also cultural life, sports life, just life in general on campuses. So that is why we're making a very strong call out today, because it's going to be opening up that possibility. It's been very difficult for over a year, and the vaccination is what opens the door to life on the campus. Of course, following guidelines, health guidelines, but everybody will be able to go on campus, and that is what we are. That's what we are emphasizing today.
Bonjour à tous. Ma question me demandait pour M. Paré comment.
I was wondering, Mr. Paré, how is it going to be decided whether it's school or clinic? Is it, for example, space in the gym, the number of students for the bigger schools? What are the criteria? Well, the answer is all those answers. I think that you are touching upon certain elements. There will also be proximity of a vaccination site. A mass vaccination site is equipped a little bit like Mr. Dubé was mentioning. We are equipped to do a lot of volume, so it's a lot quicker. So we can continue with exams or other activities at the end of the year. So that's a very good option. At the same time, we want to keep every option possible, and the final decision will belong to the school setting in collaboration with the CIS and the CIUS. They're used to working together, and they will find the best way. But for us, we'll just guarantee that the vaccine is available. That's not going to be an issue. And for the means, we'll let the local authorities decide how to do it and how to go about it. Mr. Roberge, you, of course, know that young people are already late because of the lockdown and everything else. Is that not adding even more weight to school boards and teachers to ask them to manage vaccination on top of it? The vaccination in school setting is nothing new. Every year we do it in high schools, vaccination for PH and for hepatitis in grade 4. HPV. And I remember the last time that there was a massive mass vaccination in 2009 for H1N1. A little bit like what we're doing right now. You know, students would leave school, would take the bus, would go to the vaccination center, would come back. So it is something that the network is fully able to do, and that teachers and organizers in schools and service centers and school boards, they can do it. Of course, we don't do it every day, thank goodness, but it is the key towards a great back-to-school period in September. So it's good for students, and it's good for families, it's good for teachers. So yes, it's an effort, a one-day effort for a student or a teacher, but I am quite convinced that the network is even happy to be able to participate in that effort.
Merci. Alors, nous allons maintenant passer aux questions en anglais.
English questions now.
Avec les journalistes présents dans la salle, s'il vous plaît, bien indiquer votre nom et votre média.
Hello, it's Angela McKenzie with CTV. My question is for Minister Dubé. The timeline for teens between their first and second dose is shorter than for the rest of the population. Do you anticipate you'll be able to shorten the wait time between first and second doses for adults or high-risk groups in the near future?
Well, this is what we'll be able to evaluate when we finish the first dose, because remember the timeline, we're still not finished with the first dose, for example, in RPAs for long-term residents. And we are not finished yet with employees of the health system. So we need to finalize those. And when we know exactly what we have as timeline for the first dose, then we can decide to accelerate maybe some even of the people that have appointment, for example, of their second dose in September. I think my best dream would be when we have those dates by the end of, I would say, mid-June. This is what Danielle and I have been discussing, is how can we accelerate for those people that have dates for their second dose in September. But we're not able to do that right now until we're finished the first dose. But we have this in mind as well.
Thank you. And I also have a question for one of my colleagues. It's about Maisonneuve-Rosemont Hospital. The employees there are asking for a date for this long-awaited new hospital. Are you able to commit to a time frame for getting this project off the ground?
Well, I think HMR has been on the table for years, and we have committed that we would find a solution for that. What we called in the PQI, le Plan Québécois des Infrastructures, we said clearly that what we have right now is what's being called a dossier d'opportunité. The big decision today on the table is what site. Do we continue on that site, or do we go for a new site, which would mean a totally new hospital? This decision is being analyzed right now. So I think what we have committed, and I've been at the site twice in the last 2 months just to have those discussions. So I think when we're ready to make this announcement, I think we have demonstrated that we can make those decisions. Unfortunately, it has been too long, for a long wait for Hôpital Maisonneuve-Rosemont. But as we did for other decisions, we'll make those decisions in the coming months, very clearly.
Thank you.
Merci. Prochain média.
René Brumer, Montreal Gazette. My question maybe for Mr. Paddy. Is your expectation to be able to vaccinate all the children who are in elementary and high schools, meaning that the system can take care of all those kids? Like parents could say, well, I don't need to go get a rendezvous on my own. I know my school will take care of it. And on top of that, or would it be preferable if perhaps parents took it upon themselves to get their kids vaccinated and help the system?
As I mentioned in French, we want to have all the possibilities. We want to make sure that if you want to come to one of our vaccination sites, you have that possibility. But if for a reason or another it's not possible, this is why we have this partnership with the schools to make sure that we offer a vaccine. In collaboration with between the CISSS and the schools. So it's not our options. We leave the option to the parents and to the youth.
But if they're in elementary or high school, they're basically guaranteed of getting a shot between now and
exactly.
Okay. And a question for Monsieur Dubé. Monsieur Dubé, we saw hundreds of young people congregating on the Oka, Plage d'Oka yesterday. It seems that there's maybe a bit of a sentiment that a lot of people have had their first shot and we're a bit free and freer to party. What would happen if people follow through on that soon this summer and start to congregate en masse with just one dose? And what would you suggest to those people?
I'll be very clear. This is exactly what should not happen. I think I don't want the beach to be our next problem. And I think what we've seen in Oka, we're not going in the right direction if that's what we do. We said clearly that all the deconfinement is conditional to good sanitary measures. And what we've seen on the beach in Oka, no, I don't think that, I'll be very clear. I don't want the beach to be the next gyms, okay? So let's be prudent over the next few weeks to make sure that we get all those first dose, all those second dose, and I think that's the way we'll go back to normality.
Okay. And if we do see mass outbreaks because of people going to beaches or
well,
gyms.
you've seen what happened with gyms. You've seen what happened with karaoke, and I don't want the beach to be. And unfortunately, sometimes it's a small number of people that make those exceptions, and everybody paid for that. We've seen that in Quebec City, what happened with gyms. So I would ask people just to look at what happened yesterday, and I'm glad that the police officer were able to do it correctly for those people. I think that's a lesson of what should not happen in the next few weeks.
Merci, Monsieur le Ministre. À la demande générale, si vous pouviez répéter votre commentaire en français.
Could you please repeat your comment in French? I'll be happy to do so, Marjorie. The question was to know what happened in Oka yesterday, and I think that all of my colleagues here agree with me. That is exactly what happened in Oka yesterday. That is precisely what should not happen. I understand people. We have a lot of compassion and empathy. Young people are looking forward to going outside. The weather's nice, but I don't want for beaches to become or to have the same problem that we had with the gym or with karaoke bars. I want to be clear with everyone. I know everyone's looking forward to going outside, but the end of the lockdown that we announced this week with the Premier is conditional. The health guidelines have to be respected. Most people, we haven't even finished, especially with the age category that was on the page, that was at the beach. We haven't even finished the first dose for that age group. That's why we're insisting we can do it very quickly. We can even accelerate it because we do have the vaccines to do so. So I would repeat, please be prudent, particularly over the coming weeks, so that we can complete with the first dose, so that we can readjust our schedules for the second dose as quickly as possible. But I really don't want for beaches or any other places like that, which are mythical summer spots, become the next problem. And I think that people will understand, and I really appreciate how the police officers did yesterday. They did it properly, but I would like for us to be prudent over the next few weeks. Thank you.
Donc, Rickle Fletcher de Global News.
Good afternoon, everyone. I was just hoping for our English viewers, if you could explain what you are announcing today and how the vaccination rollout will work in the schools, just to give a clear rundown for our English viewers.
Okay. Well, I think it's what we've said all along this afternoon is that we have some very good news. First, that we have the vaccine to be able to vaccinate quickly the 12-17, which represent about 6% of the population, roughly 500,000 students and non-students. So this is a very important category. We will be able to vaccinate those people in three key dates. First, they could be vaccinated in Montreal over the next, starting tomorrow, because they can start making their reservation for what we call the drive-thru vaccination in Dorval and in Circuit Gilles Villeneuve that we were very pleased to announce yesterday. So this is the first date, so appointment can start tomorrow for drive-thru vaccination for those. And the good news is those 12, 17 can be vaccinated with their parents in cars together in their family bubble. So that's the first date. The second date is next Tuesday. Next Tuesday means that on, and I'm correct, 25th? Yeah. 25th of May means that all the 12, 17s can make their appointment and will be vaccinated as quickly as possible. We will have, as Daniel and Jean-François have said, we will have those appointments, especially adding appointment at night and weekend to accommodate mainly the students. And basically, we will be able also to vaccinate more than that in the coming, I would say, in the coming month. The point that I would like to take advantage of this communication is that we still have in the category 18 to 40 about 350,000 people that have not been vaccinated yet. And that's the reason we opened the vaccination for the 12-17 only next Tuesday, because I think that's important for the 18 to 40 to remember that they have the next 3 or 4 days to get their appointment before we open for the 12-17. And I think that summarize what I think my colleague, Minister McCann, have said is that we want to have a very good return to school in Cégep and university. I think that's important. And for this to happen, we need to have not only the first dose being done in the next few weeks, but the second dose in August. And that's the same thing for my colleague Jean-François. And Daniel Paré has made all arrangement that our goal is to get 75% of this category as well, not only being done first dose in June, but also 75% in August. That's our goal.
Okay, my second question is that you alluded to graduation ceremonies or the prom in French. You hinted that they will be able to have some sort of graduation ceremony. Why can't you tell us if that is the case today?
Well, because on this matter, I think we understand, because we understand how important the graduation night is important for every school, every student. But we've asked public health to give us a very clear opinion on that, and we'll receive that in the next few days. As you know, we see you a couple of times a week, because I'm sure that by our next communication, we'll be able to give you a clear answer on that.
Merci. Donc, nous allons terminer pour les médias anglophones avec Lauren McCallum de CBC News.
Oui, bonjour. Hello. Nice. Can you hear me okay?
Oh, sure. Yeah.
All right. I just, the first question I have is hesitant parents and even hesitant teens who might be afraid of getting vaccinated. What do you tell them today?
I think that this is so important. I just had, I was key punching a message a few minutes ago. I'm very pleased to make a reference to a person that I have a lot of admiration for, is Pierre Lavoie. And Pierre Lavoie just mentioned on Twitter, I'm being told that he's going to be helping us in communication with the 12-17, just to tell them how important it is to get vaccinated, because vaccination means health. Vaccination means that we can go back to a normal life. So I just want to take this moment to thank Pierre Lavoie, who I think is known now to our youth, that this vaccination is so important. So I just want to thank him for this. And I think that should be reassuring for the parents that even though we understand that sometimes we have questions about vaccination, I think that now we have more than 85% of the population that want to be vaccinated. So I think we will answer as many questions that we have. We'll keep you posted over the next few weeks with our system to tell you how many people of those categories have been vaccinated, but I think we are in the right direction, and people should be reassured that we will do that correctly.
Thank you. Now, to follow up on the
maybe
story.
Jean-François Robert would like to add something.
Quickly.
Yes.
This year, we had a lot of difficulties in our school. We had some school closures. We had to close some groups, some class for like 2 weeks. We had some alert zone in Quebec, in Beauce, in Bas-Saint-Laurent. We had some mental health problems. We had some learning distance, which is a good plan B, but still is a plan B. And to put all those measures behind us and to look forward to get closer and closer to a normal life, it's important that parents and teenagers took the right information, listen to what Daniel Paré says, and what public health says, and get their vaccine.
Thank you.
And I would add also that the message is clear. For I'm going to talk about students in CEGEP colleges and universities, and so I'm talking about also 18 to 25 and beyond. It's so important because our students have suffered from isolation a lot in the past year and a half. And this is the key. Vaccination is the key to return on the campus in September, end of August. This is the key. 75% of all the adult population, 12 years old and over, to be vaccinated. So everybody has to be au rendezvous and go to get vaccinated. Let's talk about it between each other, in families, between friends. We all have to contribute to this effort because the campus is going to open because of this effort. So it is very, very important.
Merci beaucoup, Daniel. And pour terminer, Marjorie, peut-être ce que
To end with Marjorie, perhaps that I would say in French, because of the beautiful message that I just received from Pierre Lavoie, who is telling us, I have a few good ideas for our younger people. So over the next few days, we've shown you that we could be very imaginative and creative. As far as vaccination is concerned, so I just wanted to tell you that Mr. Lavoie is going to be giving us a few little ideas over the next few weeks. So thank you so much, Mr. Lavoie.
My second question.
Sorry.
If I'm still, you can still hear me?
Yep.
Okay, thank you. It's to go back to Oka. This is for my colleague. You mentioned Oka in particular, but, you know, after the government announced deconfinement measures on Tuesday, I think a lot of the population is feeling like it's already being applied and the parks are going to get really crowded. We've got a long weekend coming. So what's the plan, the government's plan, to deal with big gatherings if Quebecers don't respect the rules outdoors this season? And that's parks, cities, other places.
Well, I think if you appreciate the question, because remember, we said the rules don't change before May 28th. And I just want to make sure that if we don't want to go back to the restriction that we had last summer, or even worse, that we had after Christmas, we need to do it gradually. And I understand that people are tired, but we need to do that in steps. We need to do that to make sure that we limit the number of contacts. I remind people that we vaccinate between 90 and 100,000 persons per day. The next 10 days will help us vaccinate between 700 and 800,000 people. So that's the reason we have put those dates as being the date of changes being May 28th. Please take those next 10 days to think that it will make a big difference. So appreciate the question. Please make sure that we wait for those dates. And in the meantime, we will do our job. We will vaccinate our people.
Merci. Alors, c'est ce qui met fin au point.
Thank you. This puts an end to this afternoon's press conference. I thank everyone for their presence. Thank you, everyone.